Hi, I'd like to talk to you about a new pain treatment program that is ideal for pilots and aviators. I have been a pilot for over 20 years. I started flying when I was 17 years old, and I've been flying ever since, off and on throughout the years. Never actually been a commercial pilot or a military pilot, but I do talk to a lot of pilots. And one of the issues that I have discovered over the years is that there is typically a lot of pain involved in consistent travel and back and forth as a pilot. And that pain can actually be a major problem. So the number one problem with pain, if you're a pilot, is obviously the risk involved in not being able to actually physically function in the cockpit, being able to turn your head and to look at things like that. Obviously, headaches and other things like that are major issues for pilots. But even just back pain and sitting and the movements and things like that and involved can be major issues. And of course, even just the motion of taxiing, if you've got neuropathy, peripheral neuropathy, or sciatica, the taxiing motion with your feet oftentimes is painful and difficult to deal with. All of these issues can impact your safety as a pilot, and any flight surgeon would know this. If you've got chronic pain, it's a major issue. One of my colleagues and friends from the past years past, fighter pilot in the Air Force, and I've talked to him frequently. He actually had told me at one point that fighter pilots in general, specifically in his case, they wear the helmet in the cockpit, and it's pretty heavy. There's a lot of gear on the helmet, and they're pulling a lot of G-force and motion back and forth, and they're constantly looking around. So they're pulling G-force while they look around with a giant headset on, and they just all have neck pain, shoulder and neck pain from that. And I could believe it. And when I talked to him, he expressed his frustration with the ability to get pain treatment without risking being grounded. I mean, if you're a flight surgeon and a pilot tells you, I've got chronic neck and back pain, and I'm taking NSAIDs, aspirins and Tylenol and ibuprofen to actually cover this pain. Of course, the flight surgeon is concerned about that. That's his job to keep pilots safe. And if you've got a chronic pain issue, you have risks, right? So there's all these pilots out there that are afraid to approach this chronic pain condition with real treatments, because oftentimes the treatment is going to be something that may potentially get them grounded. Obviously, you can't fly if you're on a variety of pain medications. So neurofunctional pain management, that's what I want to talk to you about today. Something that I've been doing for years. It's a treatment program that I developed back in 2018. It uses a high pulse electroanalgesic therapy combined with IV nutritional therapy and health coaching. So this combination of therapy, we have had a tremendously successful outcome with for years. Treated thousands of patients across the country with this program. And this entire time I have known that this would be an ideal treatment for pilots and aviators, specifically because it's non-pharmaceutical, non-surgical, and non-invasive. So in this model, we are actually using this high pulse electrical current to produce what's called neuron depolarization. It actually relieves the pain signal to the brain, it inhibits the pain and inflammation cycle, reduces that cycle. So that's one of the ways that it's producing pain relief. Additionally, it is also stimulating the release of neurotransmitters and neuropeptides that are very successful in helping to make you feel better and to actually induce pain relief. Endorphins, enkephalins, and GABA are three of the most common neuropeptides being released, neurotransmitters being released during this electrical therapy. And so a lot of people do just feel good for days after having gone through the treatment program. And of course, if you have chronic pain, a lot of people in chronic pain typically are also dehydrated and also nutritionally deficient in one or more vitamins. Even if you are healthy, you typically have some deficiencies in different vitamins and minerals. And so the IV does help with that process as well. So going back to how can this treatment program really work to keep a pilot safe and in the air? So let's just say you've got a chronic back pain issue, right? This program, if you go through the program, it's a nurse will come out to you. We actually have a structured as a mobile program. So nurse will come to you, treat you at your convenience, by the way. So if you have a schedule and you're flying back and forth and you've got, schedules and things to meet, the nurse can actually work with you on your time frame, treat you twice a week in your home for an hour each time. And that's typically going to be ordered as an 8-week program. So it's an 8-week treatment cycle and with 2 treatment events a week for an hour each. And those events are typically fairly relaxing. You're just sitting in a chair, the electrical, devices connected to you, and the programs are run, and the nurse is there to manage that. And then you feel great for days, really afterwards. But the ideal scenario here is to produce an ongoing effect, which is what happens. So if you got a single treatment, you might see results occur, for 2 or 3 days. It feels great. 2 or 3 days later, the pain starts coming back. If you do this twice a week for 8 weeks, you can produce pretty long-term effect. We aim for 3 to 6 months of ongoing pain relief with every patient. Now, not every patient achieves that long. Most patients will achieve some sort of impressive duration of time in months and months of pain relief afterwards. Some patients, it may be a number of weeks, but even still, they're feeling better during treatment, and they actually have several weeks of pain relief after. Still, that's what are the other options, right? You can't take opiates. There's a lot of pain meds you can't take at all. A lot of steroids and spinal injections, things like that. A lot of these invasive procedures also interfere with your flight, safety, and also other medications you might be on. It interferes with those, and a lot of these invasive or interventional procedures may also keep you from flying for a number of days or maybe weeks as well. And additionally, if you have to go undergo surgery, everyone knows that's going to actually be a problem for you as well. And there's going to be a period of time where you can't fly. So all those things being said, this neurofunctional pain management, I believe this is probably the best possible treatment model for pilots and aviators, just because non-pharmaceutical, so you got that category is gone, non-steroidal and non-invasive, so that whole issue is gone. Non-surgical, that whole issue is gone, and it's convenient because the program is mobile and they come to you. So, I mean, it's pretty amazing that this has not been identified, sooner in the field of aviation as being the best pain treatment option. A number of doctors out there do. I mean, most doctors, I'd say most doctors have never heard of this at all. A lot of pain doctors do know what this is. They know what electroanalgesic therapy is. They've just never really used it because, like I mentioned, it's got the time frame associated with it. Most doctors just don't have time to deal with that. They're not in a position. It's not negative. It's not negative against them at all. They're just not in a position to be able to manage dozens or hundreds of patients coming in and spending an hour in the office and doing this treatment. It's not possible for them to do that. They focus on faster things. They cycle through patients more often. They have to. That's what they do. They've got hundreds of patients being thrown at them to manage their pain, and they do the best they can to handle that volume, which is going to be, if you're a medication management doctor, it's going to be scripts and pills. If you are an interventional, pain doctor, it's going to be injections, procedures, and surgeries, and that's it. In this model, you've got this safe and effective therapy that is, by the way, also all of this is covered by insurances, Medicare and commercial insurances. So this will, most likely be covered by your payer. And most likely, if you are a commercial pilot and the ability to keep you flying in the air, this might actually be a welcome treatment model by your employer, whoever that is. Military, I've already talked to a lot of military personnel about this. They've been very excited about this treatment model. So it's something that I hope that military leaders and people can see the value of keeping pilots, in the air, keeping them out of pain, reducing that risk. And I'll say this too. I know a lot of pilots out there, hearing this, there's a lot of unspoken medical needs. Pilots, there's been a lot of interest over the years in trying to get pilots to be more forthcoming about medical issues, just for the safety purpose. But if you're the pilot talking about your medical issues, that there's always going to be a risk of you not being able to fly, right? And limiting your ability to actually perform. Just because you're speaking up. So there is this, what I call it, underground disincentive to want to talk about your pain issues. If you can just push through the pain issues, get through the flight. You can take some, NSAIDs when you get home and get some sleep and feel better and get back to work, right? And that's what a lot of people are doing. A lot of pilots are doing that. But I do know that I've talked to many pilots. I've been a pilot for 20 years, and I've seen and heard these stories consistently the whole time. So when I finally did bring this program out into the market back in 2018, that was one of the first things I thought, well, this would be perfect for aviation. I myself wasn't suffering from chronic pain, but I knew plenty of pilots who were. So hoping that this video is useful to you as a pilot, as an aviator. Our program does exist in many states. I'm hoping by the end of the next 12 months, I'm anticipating we'll be in almost all 50 states to some capacity, with mobile nurses being able to perform and offer treatment all over the state and across the country. So reach out to us. I've got the link to our site below. We'll be able to get you connected, do the insurance verification, get the telemed visit scheduled with the provider, get the program ordered for you, and get a nurse out and doing the treatment for you. So yeah, I got the link below on the description of the video there. I'd love to hear from you. I'd love to hear about your, throw me a good flight story, good pilot story. I'd love to hear that as well. But I'm looking forward to working with you and hoping we can do something good for you, keep you in the air, and get you out of pain. So again, thank you for watching the video. Look forward to talking to you soon. Thanks.